This is my audience, and now one of my audience members will hold the phone as I present. Hello, everyone. My name is Megan Wood, and I will be doing an informative speech on different types of birth control methods. I want you to take a second, think silently. Now, just imagine how the world might be if America did not have any sources of birth control. Let's just say, thank goodness, we have many forms of birth control. Birth control methods are not only a preventative for pregnancy, but there are also positive insights as I begin to inform you more. After intense research on my different types of birth control, I have understood why it is so important for women to have a gynecologist. I hope to help you understand more on these different types of birth control methods. There are 12 different types of birth control. The first is the combination pill. The second is progestin pill. The third is extended cycle pill. The fourth is vaginal ring. Fifth is diaphragm. And the sixth is IUDs. The seventh is female condoms. The eighth is male condoms. And ninth is patch. And the 10th is implant. Sterilization, and lastly, emergency contraceptive. Birth control is used for unwanted pregnancies and a contraception. Some birth control methods, such as the pills, don't just help with unwanted pregnancies. Sometimes when a woman has begun adulthood, she will need to find an OBGYN. Then the doctor will perform a pelvic exam. Then the doctor will also start discussion or ask about using different types of birth control methods. Taking birth control, the pill that will be advised due to help preventing different types of things happening with a woman's uterus, such as ovarian cyst, pregnancies, and other cancers that a woman might occur in her uterus. We'll now start talking more about the 12 types of birth control. First, I'm going to tell you a little history about birth control. The year birth control come about was the year of 1950, while in her 80s, Sanger underwrote the research necessary to the first human birth control. She raised $150,000 for the project. In 1960, the first oral contraceptive and Drug Administration, FDA, as contraception. Now, let's discuss the 12 different types of BC. First off, we will begin discussing the combination pill. These pills prevent pregnancy, allow you to have a period only every 3 months. Note, Liberal stops your period for a year, but you must take a pill year-round. What are the cons of this contraceptive? Well, there's actually no evidence proving if it's dangerous to have periods or not. But there's still no long-term research to show if it is safe. The second is the vaginal ring. What it is actually called is the NuvaRing. What it does is the ring made of flexible plastic and delivers estrogen and progestin, just like the combination pill. You place the ring in your vagina for 3 weeks and then remove it for 1 week so that you have your regular period. Women who smoke or have blood clots or certain cancers should not use the NuvaRing. Thirdly, we will discuss about diaphragm. It is actually called the Melix, Wide Seal Ortho All Flex Semenia, and Silix. It is made of rubber and shaped like a dome. Diaphragm prevents sperm from fertilizing an egg. It covers the cervix and must always be used with spermicide. Women must be fitted for a diaphragm in their doctor's office. If your weight tends to fluctuate more than 10 pounds at a time, the diaphragm may not work. If you gain or lose weight, you will need to be refitted for the diaphragm. If you're prone to bladder infections, you may not want to consider this birth control option. Use another one. If you had toxic shock syndrome, you shouldn't use diaphragm either. The Paragrand is a surgically implanted copper device that prevents sperm from reaching the egg. Mirena is the name, also surgically implanted, releasing hormones. IUDs are more than 99% effective and is good for 10 years. Some doctors recommend the device only for women who have given birth. When the device is implanted, your uterus is expanded, and this might cause pain if women who have not had children. If you are planning on having children in a year or two, look at other options. The IUD can be removed, but the high cost up to $500 might be not worth it for the short-term use. The female condom for polyurethane or soft plastic and protects against the STDs. It is inserted deep into the vagina over the cervix, much like a diaphragm. Unlike the male condom, the female condom can be put into place up to 8 hours before sex. Male condoms offer more protection, mostly against STDs and pregnancy, than female condoms. So if your partner or in a long-term relationship is monogamous relationship, you should use a different method. Male condoms also prevent STDs, pregnancies, and HIV, which plays a huge part. Worn properly, condoms prevent sperm from entering the uterus. Go with latex or polyurethane condoms. Lambskins do not shield you against all STDs. If your mate is allergic to latex or polyurethane, you will have to find another source. Be smart about which source you do choose. Using a lubricant that contains oil, such as hand lotion or baby oil, you find the need to switch the oil-free option like KY jelly, which, unlike oil-based lubricants, doesn't degrade the latex. The patch, which is called the Ortho, you can place the hormone-releasing patch on your arm, your buttocks, or your abdomen and rest easy for 1 week. If you're particularly at risk for blood clots, you might want to find a different method. The patch delivers 100% more estrogen than a low-dose pill. So if you're increased for dangerous blood clots, find another source. Another form of BC, which we abbreviate nowadays, is for birth control. It is an implant called Implanon. The implant is about the size of a matchstick. It's about this size. It is placed under the skin on your upper arm. It's going to be about right here. Implants last for 3 years and cost up to $800. They are nearly 100% effective. Who should avoid it? Well, the implant may not work as well for women taking St. John's wort or women who are overweight. Lastly, but not least, sterilization is another form of birth control. Other names for sterilization is Ensure, tubal ligation, vasectomy. Women undergo either tubal ligation or surgical procedure that blocks the fallopian tubes for carrying eggs to the uterus, or tubal implants, which is Ensure, a non-surgical technique in which a small coil is inserted into the fallopian tubes. Now, here are some other decisions either women or men can make, which are: the sterilization process is less risky for men. A vasectomy is a minor surgery in which the tubes that carry sperm from the testicles are cut. If you plan to have children, sterilization is not a good form of birth control. You need to find a different one, and it is not designed to be reversible either. Finally, the last BC method will be organized as a contraception. The names are Copper T IUD, Next Choice, Plan B, or Plan Next Step B, Emergency Contraception. Is a backup for regular BC. Plan B contains higher dose of same synthetic hormones found in the combination pill. It works best if taken within 72 hours unprotected sex, but may work up to 5 days later. There's also Copper T IUD, which a doctor can insert with your uterus 5 to 7 days after your unprotected sex. Plan B, known as the morning after pill, is available over the counter at most pharmacies, but only for 18 years and older. If you're younger than 18 years, you may have to have a prescription. Copper T IUDs can be very expensive, up to $500. Plus, they last up to 10 years. So if you hope to get pregnant in the future, this isn't for you. No Copper T IUDs. I hope tonight I have informed you of these different types of birth control. And here's a visual aid that I have that I want to show you guys. You may or may not already know, but right here on this left side is the most effective, in the middle is not so effective, and this is the least effective to your right. The most effective is going to be your hormonal IUD. It's going to have the implant or the Copper T IUD, which we just discussed. And then here in the middle is going to be the NuvaRing, the patch, the injectable, which is the injection of the hormone pill, and here's the pill. Okay, and your least effective is going to be pulling out, which no, condom, yes, or natural family planning, which may help some of you people who are married and not wanting to make many sterilization progression. But that will be it tonight, and I hope you have a good night.